Good afternoon. Thank you for joining us today for our COVID-19 media update. San Diego continues to head in the right direction. We continue to see progress with our case rates. We see the number of vaccines, again, continuing to be a leader in the state of California. We see plans for more school openings, and we are confident that we are on the path to a lower tier. But at this point, it is vital to continue to reinforce that all of the things we're doing to slow the spread, that's what's helping facilitate our progress. That's what's getting us on the path. The combination of those actions we're taking to protect one another and the availability of vaccines have put us on a good path, and we're encouraged by the general direction that we are going. We vaccinated the vaccinators, we vaccinated healthcare workers, we've now vaccinated close to 70% of our seniors. 100% of our skilled nursing facilities have had multiple visits offering vaccines to the residents. 93% of our long-term care facilities have done the same. And San Diegans should be proud of the progress that we've made. I was excited to hear President Biden say that there will be a vaccine available to every adult in America by May. I will be more excited when that increased supply of vaccines actually start arriving. We continue to have challenges and not enough vaccines arriving. We are at times struggling to keep pace with the second doses, which is obviously our priority. But we remain hopeful that the supply will increase. We've certainly built out enough capacity to do significantly more vaccines every day than we're doing. And we are hopeful that that supply will increase. We are also hopeful that the J&J vaccine will arrive soon. As a one-shot option, we think that that can obviously speed up and have a positive impact on what we're doing. But everything that we're doing moving forward has put us in a relatively strong position. And although our case rate, as reported by the state this week at 10.8, was not low enough to get us into the current red tier system, we do believe that there is a high possibility that in the next few weeks, in the coming weeks, we will be able to go into that lower tier. Again, we have to see continued progress with lowering our case rate, which means we have to keep vaccinating folks, and everyone has to do the things they're doing every day to slow the spread. But we've also been in conversations with the state of California around some possible adjustments to the formulation. When the tiered system first came out, there was no vaccine. And so the calculation of X number of cases equals Y number of hospitalizations was different than it is today. We moved swiftly to vaccinate a significantly large percentage of our seniors, and that begins to change the calculus. And so we think it's possible in the coming days the state of California could alter the case rate needed to go into a lower tier. And if that were to happen, and if we continue to make downward progress in our case counts, we think it's possible in the coming weeks that we could descend into that red tier. It's possible that what is allowed to be open in the red tier could also change along with the formula. But I just wanted to share briefly, again, with the understanding we are in the purple tier now, but we are optimistic that we're headed towards a red tier. I just wanted to share and remind folks of what the red tier would look like if we do arrive there, and I think we have a slide to represent that. Changes from the purple tier, if we were to move into the red tier, would be restaurants would be allowed to have indoor dining at 25% capacity or 100 people, whichever is less. Museums, zoos, and aquariums could have indoor operations at 25% of capacity. Retail could move to 50%. Gyms could restore indoor service at 10% capacity, and movie theaters could restore indoor capacity at 25 or 100 people, whichever is less. And so as our businesses out there start thinking about what's coming, we just want to remind you this is what the red tier looks like today. But again, we are not there right now. We remain in the purple tier, but we do think the combination of our descending case rates and the probability of a change in the formula in the coming weeks will give us an opportunity perhaps to descend, and we know that that will be some welcome news and relief, particularly to those impacted businesses that have been struggling. Unlike other states, though, in San Diego and California, we will not be abandoning things like utilization of face coverings. We are not giving up in the fight against COVID, and we're reminded daily it's easy to become numb to what we face. But just today, we're reporting 25 additional deaths from COVID-19. And you know, we often see coverage associated with deaths. We are touched by the tremendous tragedy and loss of life of a horrific vehicle accident, but we're reminded that that equivalent loss of life or greater has been happening almost every single day from COVID-19, so it's still here. And we're excited about the vaccinations, and we're excited about descending case rates, and we're excited about schools coming back and the prospects of fans watching baseball at the beginning of April and a lot of things that seem possible. But now is not the time that we abandon the things that have gotten us in a strong position. And so we continue to encourage the public. We know what to do. Wear the face covering, physically distance from non-household members, avoid high-risk settings, and let's continue to see progress, and let's work our way out of this in a smooth and steady way. We are also nearing the milestone of administering our 1 millionth vaccine in San Diego County, but that is also met with the sobering reality that we have a shortage of vaccines. Many of our sites are struggling. Again, they don't make the vaccine, but they are working as hard as they can to try and honor those second dose appointments. And we are also trying to ensure that we can get as many vaccines as possible into these new tiers that have been stood up for our teachers and education staff, for our emergency responders, and for our food and agricultural workers. And so we are going to continue to do everything that we can, anxiously awaiting the arrival of the J&J vaccine. Moderna vaccines have seen significant shortfalls, and that is evidenced by the number of San Diegans very frustrated with not being able to get their second dose. And I know all of the sites that are administering these are working, the county's working, everyone's working collaboratively to try and get them in arms. But we do hope that the increase will happen soon. With that, let's jump into our charts today, and then we'll hear from Supervisor Vargas. Here you just see the dashboard again, as reported, 945,000 total doses administered. We know that we've got about 7,300, a little bit more than that have been administered or pending the documentation. And then you see the significantly large number there that is to be administered. Those are appointments coming up. Obviously, those three numbers get you to a number higher than dosages received. And so that's creating a little bit of the challenge and strain. But again, we're hopeful that it will increase. But we are encouraged. 22% of eligible San Diego County residents, those 16 and older, have received their first dose, and more than 10% have received their second dose. Again, on the ecosystem part, I just want to walk you through all of the various parts of this. We have our county-hosted vaccine events, our vaccination superstations, our mobile vaccination teams that are out. Our hospitals continue to do great work providing vaccinations on site, as do our clinics. We have city partnerships with a number of cities throughout San Diego County, along with the Military and Veterans Administration, which is doing their own, and our pharmacies. So there are multiple input points, a very collaborative effort with people trying to administer vaccines. And on the next chart, you can just see a quick snapshot of where we are right now in terms of current superstations, current county and partner pods, and then the overlay of pharmacy locations. So you can see a very robust network of locations and sites. But again, those work best when they have a steady supply of vaccines, and we're hoping to see an increase. The next chart here is just a quick update on the progress we've made just in the month of February. You can see the progress we've made in adding multiple sites and adding superstations, partnership events, operation collaboration, mobile vaccination teams, and so forth. And you can see there at the bottom, our estimated capacity is we could do 33,000 vaccinations a day today with the infrastructure we have. That puts us at almost 1 million vaccines a month. But again, that's dependent upon supply. And if we had that many vaccines, I am confident we could increase our capacity even more. So we continue to ask for folks' patience as the supply of vaccines hopefully increases soon. We have focused, continue our efforts to work through our seniors. You can again see our long-term care facilities and skilled nursing facilities. Again, these have been made available to folks at those sites. And we also continue to work on our equity programs. We know that we have more work to do here. On the next slide, you'll see both 211, supporting those 65 and older, making appointments over the phone. I appreciate the work of 211. We get regular updates. You're talking about 18 to 20 second average wait time for individuals in speaking to a live operator, and the ability to schedule appointments. We have locations in the hardest hit communities. We've been piloting no appointment sites, restricted eligibility to the neighborhood zip codes where people can walk up and do it. And then our scheduling assistance for vaccine equity, again, continues using our promotoras, our community health workers, to support eligible high-risk individuals. And you can see all the groups we're partnering with there on the bottom. I mentioned our cases remain low. You can see that here. Today we're reporting 352 cases. Again, you've got to go back to the early fall of last year, late fall of last year to see numbers this low, and this is encouraging. Obviously, the number of tests are less as well. San Diegans are just not getting tests at the same volume that they did when it was a much higher spread and much more serious. We continue to have testing capacity available. Beyond that is being utilized, so if folks want to get a test, we still have testing sites throughout San Diego County, and we encourage people to go and do it. And then, as I mentioned, the unfortunate loss of life continues to remain. Today we're reporting 25 additional COVID-related deaths, bringing us to 3,342, and our condolences go out to all of these families. And again, this is a powerful reminder that it's still here, it is still deadly, and so we're making progress and we're moving, and we're excited about that. But we can't lose sight of continuing to be in the fight against COVID-19. And then my final chart here just shows our progress. Again, you see our case rate there, 11.3 on the bottom left there, 10.8 is our adjusted case rate. And you see the progress that we're making. And if these trends continue, and they may not, at some point we're going to kind of plateau a little bit. But it is very likely that we hope next week these numbers will be lower. And then, of course, we have the possibility that there could be some adjustments in the formula. We will keep you posted on that, looking for any updates, and we'll continue in discussion and deliberation with the state of California on what that looks like. We'll next hear from Supervisor Vargas. Then we'll get to your questions. Both Dr. Wooten and Dr. McDonald are here available for questions as well.
Thank you, Chair. And absolutely, we must now more than ever remain vigilant, and we can't let our guard down. We can't emphasize this enough. I think that's one of the things we want to make sure we remind everyone. We want to continue wearing our masks, continue practicing physical distancing, and avoiding large gatherings. Being vigilant is why we have been able to get our cases down to where we are right now, and so we're trending in the right way. I did want to make sure that I circle back with all of you and want to give you this opportunity to give you an update on where we are with some of the interventions that we've implemented to ensure that the vaccine distribution is being done equitably. And I want to share that the interventions are working. I want to expand a little bit and take a little bit of a deeper dive in some of the information that Chair Fletcher provided before. And I'm happy to report that with the expansion of 211 since January 22nd, we've actually made 176,249 calls were made to the 211 line. And out of those, over 68,000 were COVID information, over 45,000 specifically were vaccine or appointment information. And I am happy also to report that over 27,000 vaccine callers elected to speak Spanish to a 211 agent. And the average wait was about 2 minutes and 44 seconds, which I think was great because we were able to quickly be able to get up and running to share this. And I think the other piece that's important is about 16% of those appointments were for vaccine calls, and we were able to make those appointments, as well as over 500 clients indicated that they were homebound seniors and were placed on interest lists to make sure that they got their vaccinations. In addressing the hardest hit communities in South County, I think most of you know that we've not only do we have the pods in terms of the vaccinations, but we also were able to pilot this weekend two particular programs. One of them was at the Chula Vista Superstation with some of the local markets. And then in Otay Mesa, we were able to restrict specific populations. And you can see the slide with the zip codes. And so we had at Vortabue Family YMCA, about 200 walk-ins, no appointment vaccinations were available. And it really gave us an opportunity to see if this process is one that we could continue to do as we're moving forward, and we're trying to make sure that we reach some of the folks who don't have access to technology, and we know that the digital divide is real. And so this has really worked, and we're going to continue to, it's all based on vaccinations, how many vaccines we have, but we're going to continue with these programs to make sure that that people are eligible. And just a reminder, we're still focused on the tiers that are available in order for people to be able to have access to a lot of the child care providers, as well as folks who work in different markets were the ones that we're mostly targeting during this time. We also, I think we have mentioned before, that the Project SAFE, Scheduling Assistance for Vaccine Equity, has been a program that we've been continuing to monitor and continue to provide resources. It really is making sure that we are accessing opportunities in the community and that people have access to promotores that are helping with the appointments. Again, the challenge that we're having right now is the number of vaccines. But what's important to note is that we are trying to make sure that we are creating this infrastructure that is going to be available as soon as more vaccines are here, people are able to make their appointments. And so I do want to mention, and I'll mention this during my Spanish remarks, I'll share some of the PSAs. PSAs are going out in English and Spanish, and particularly important because there's a lot of misinformation about vaccines and how important, and we want to emphasize how important it is that once it is your turn, we want everybody to be able to get vaccinated. And last but not least, I'll share that the board of supervisors took action this week to prioritize how we're going to be addressing future federal funding and state funding that comes down to our communities. And so we will be hosting community workshops where we're going to be able to have an opportunity to hear firsthand from residents and community members about how we should be prioritizing future funding, in particular around COVID. And so we will be providing additional updates on this, but we wanted to make sure that we share that with you today. Mi mensaje hoy en español es simplemente para enfatizar de nuevo la importancia de que cuando ya sea su turno que se vacune, por favor. Si ya es elegible, no se les olvide hacer su cita para poder ir a que le den su vacuna. También, aunque los casos de COVID y de hospitalización en nuestro condado se han reducido, no hay que bajar la guardia y tenemos que seguir usando nuestros cubrebocas, estar solamente con las personas que conocemos y no salir de ese núcleo de familia que tenemos, ¿verdad? Algo que nos queremos informarles es que este fin de semana empezamos un programa piloto específicamente en el condado de San Diego. Es un programa piloto que queremos ver si funciona. Podemos hacerlo en el norte del condado y en otras áreas. Pero es importante notar que este programa lo hicimos con las personas que proveen cuidado a pequeños y además para las personas que trabajan en los mercados y en los supermercados más que nada. Lo que hicimos fue proveer vacunas donde no había citas y funcionó el sistema. Lo hicimos en el programa en Otay Mesa. Ese es un programa de Baby donde pudimos dar las vacunas para las personas. Y nomás que solo queremos recordarles que pues desafortunadamente ahorita tenemos el problema de que no hay suficientes vacunas, pero vamos a seguir creando la infraestructura para cuando las vacunas lleguen, las personas tengan dónde ir. El condado también está haciendo todo lo posible para dar información a nuestras comunidades acerca de la vacuna, donde puede ir a obtener una vacuna. Entonces, empezando este mes, tenemos una campaña de educación pública con anuncios en la radio, incluyendo La Invasora, Pulsar, Univisión Qué Buena, Univisión Amor y Radio Latina 104.5, entre otras. Así que a continuación les vamos a tocar el anuncio.
Cuando sea su turno, vacúnese contra el COVID-19 para protegerse a usted y a su familia. La vacuna no contiene un virus vivo, es segura y ayuda a enseñar a su sistema inmunológico cómo reconocer y combatir el virus. Obtenga una vacuna gratuita para poder regresar a pasar tiempo con sus seres queridos. Su información será confidencial y no se compartirá con agencias federales o las autoridades. Visita coronavirus-sd.com/vacuna.
Estos mensajes de radio van a empezar esta semana que entra, así que estamos muy emocionados porque más que nada, pues sabemos que hay mucha mala información, mucha información incorrecta en las redes sociales y hay muchísimas preguntas que las personas tienen. Lo que sí quiero que sepan es que mi equipo y nosotros hemos desarrollado un documento en inglés y en español con un recurso para la comunidad con respuestas de preguntas frecuentes. Así que vamos a demostrarlo. Les dice vacuna para el COVID-19. Si van a la página web, tiene toda la información y lo que estamos haciendo es que ustedes tengan la información más adecuada que está llegando y para que puedan preguntarnos cualquier cosa que tengan. Así que estamos a sus órdenes. Muchísimas gracias.
Thank you. We'll now go to our call-in questions.
This first call is from Brandon Lewis with Channel 8.
Thank you for taking my question. I actually have two. The first one is I wanted to clarify something, Supervisor Fletch, that you said about the purple tier being based X cases and Y hospitalizations. I think it's about 12% of cases that were going to the hospital. What are you seeing today that's the basis for the argument of making this change? And then separately, I have a question on skilled nursing facilities. We're seeing a decline nationwide in new COVID cases at SNFs, many attributing to that to vaccine. So I'm wondering, here locally, can you give us an update at how our SNFs are doing? And I noticed there's still some outbreaks. Just an overall update would be helpful, please.
Yeah, I'll have either Dr. Wooten or Dr. McDonald give you an update on what we're seeing in terms of percentage of cases being hospitalized, along with what we're seeing in SNFs or long-term care facilities. But it's a really important, Brandon, and I know you got this, but we don't know what the change will be. We anticipate a change coming. We've been in conversations with it, but we'll obviously have to wait for that change. We think it could come in the coming days. But let me see if one of them has the latest numbers as it relates to hospitalizations as a part of cases or what we're seeing in SNFs. Dr. Wooten will do that for you.
Thank you for that question. I don't have the numbers before me, but we consistently produced the numbers for 30, 14, and 7 days for what the hospitalization admissions look like. And they have been declining. 30 days, it's been consistently about around 60%, then about 30 to 40% in 14 days, and 7% or 17% reduction in 7 days. So it is declining. That's the important news. And we can get the actual stats for you. We do that for hospitalizations and ICUs. And in the regarding outbreaks, if we look at SNFs and non-SNF congregate settings, we are seeing a reduction in outbreaks in those locations, as well as a reductions in our community settings. So all of the numbers are going in the right directions. We have actually in today's slides that will be posted, we actually have a breakdown of cases and deaths by settings. Again, those 3 settings are SNFs or skilled nursing facilities, then non-skilled nursing facilities and community settings.
Do you attribute that to the vaccine?
Pardon?
Do you attribute that to the vaccine?
Oh,
The
yes.
reduction
Oh,
in SNFs specifically?
absolutely. It's multifactorial. Certainly vaccinations, it's attributed to that, but it's also attributed just in general in the community to people adhering to the preventive measures that we've been just begging people to adhere to over the last year. So I think it is all of those factors that are involved, and that's seeing our numbers come down. Thank you.
Thank you, Dr. Wooten.
And Brandon, too, I think in those facilities, it's important to note it's a decline in both the residents and the staff, and the efforts to vaccinate those staff obviously help control the spread there. So, yep. Thank you. Next question.
This next question is from Jonathan Wozen from the San Diego Union Tribune.
Hi, thank you for taking my questions. I know we've talked a lot about vaccine supply being uncertain. Can you provide any kind of update in terms of where things stand with Moderna doses coming in? I know in the past weather was an issue, but it's not clear to me why that would have affected our supply of Moderna more than Pfizer vaccine. So just anything you can tell us in terms of why we have those delays and when any vaccine might be coming in the next couple of days. And then second question, just circling back to the Johnson & Johnson vaccine, Supervisor Fletcher, I know you said last week that, it'll help, it won't hurt to have a third vaccine. Obviously, the FDA has authorized the vaccine, CDC has cleared it as well. So presumably it could be coming any day now. So if you could say a little bit more about the actual plan that you guys have in place to administer that vaccine. Are firefighters going to be delivering this to farm workers in the fields? How will we actually incorporate that vaccine into our current plans?
Yeah, so let me take your first one, and then I'll have Dr. Wooten touch on the plans for J&J distribution. Jonathan, I wish I had a better answer for you. It is consistently erratic and consistently unpredictable, and we again. When it arrives, we get it in circulation right away, and we utilize it as fast as we possibly can. But we still don't have great clarity on what will be coming more than a day or two in advance. And as we've seen in the last few weeks, even when you're told something is on its way, doesn't mean it's actually going to arrive. And so this is a struggle, and this is very hard. And I know it creates frustration because you have, sites open and then sites have to either scale back, or in some instances they have to pause. Folks have had second doses rescheduled. And again, it is a great frustration. We do hope, and we keep hearing that there's going to be significant jumps in the numbers, and there's going to be all of the vaccines going to be there, and we're going to have this schedule of what's coming with great predictability and reliability. And when that happens, everyone's life will be much better. That just hasn't actually happened yet. And so every day a team gets up and they work incredibly hard to track down every possible vaccine and move Pfizer from here to there, and move Moderna from here to there, and see who can kick in some of what they were sent direct, and how they can do everything possible to get as many people vaccinated and fulfill as many appointments as possible. And we are eager for the day when that's not what daily life is like. But right now, you do what you can with what you have where you are. And where we are right now is great uncertainty. What we can is get them in arms with what we have when they actually show up. And so we're going to continue working through that in hopes that it gets better soon. But J&J obviously would be great to arrive, and I think there's a lot of prospects, and I'll let Dr. Wooten share the plans for how J&J would be put into the system.
Thank you for that question. I want people to understand J&J is a safe and effective vaccine. It just happens to be third in line. If we had received it first, we would be talking about how are you going to administer Pfizer or the Moderna if it was the third one in line. I'd like to start out by saying first that of the allocations that we get to for our region, we only receive anywhere from 25 to 35 or 40% of the allocated amount in any given week. And we order and receive vaccinations twice a week. So that's the first point. We will plug the Johnson & Johnson vaccine into all of the strategies that we are currently using for Pfizer and Moderna. Keep in mind also that while J&J vaccine is a one-dose vaccine, manufacturers in the federal government are already talking about developing a booster in the fall, not only for J&J, but also for Moderna and Pfizer. So again, this is a safe and effective vaccination. It is one dose compared to two. And it can be utilized for some unique populations, but we are going to plug it in for all of our vaccination sites for the general population, and then utilize it in those cases where it might be more efficient to vaccinating certain populations. But in that regard, it's going to be utilized just as we've stratified our Pfizer and Moderna vaccines. Thank you.
Thank you.
And Jonathan, just to add on to that, we think there's not only the benefit of a single dose, which can help with some of those harder to reach populations. I was out this weekend as we were vaccinating farm workers, and to go back to that same site and have to match that same person 21 or 28 days longer, it would be easier to offer them a J&J vaccine and they would be done. But it's also a little bit more durable. It requires a little less infrastructure to move, and so that makes it I think a great value add to some of our mobile efforts and mobile components. So that, plus as Dr. Wooten mentioned, the integration into the system as a whole, we think will help. Plus it's just more vaccines, so more vaccines is good. Next question.
This last question is from Paul Sisson with the San Diego Union Tribune.
Thanks for taking my call. Getting a fair number of emails and phone calls today from folks who are stuck in line waiting for their second doses at Petco Park. That site has indicated they're going to do something like 4,000 doses per day. Seems like other sites, super sites in San Diego County, for example, the fairgrounds, are doing something on the order of maybe like 1,500 doses per day. Is there any effort to spread these doses around a little bit so we're not sending so many thousands of people into the streets of downtown San Diego and having this kind of perennial traffic snarl every time they're back up and running?
Yeah, Paul, we are working. Obviously, that one stood up first and got a really significant volume early because it was the first one up, and a lot of that is now catching up with people returning to the same location to do their second dose. We think some of this will work out a little bit as we now have more sites and more locations, but we also have to plan for. We know that the Petco site will have to move by the beginning of April to coincide with the start of baseball season. So I think there are efforts to try and stabilize and disperse a little bit, along with streamline, and we continue to work with the folks at Petco to, maybe they can do a few less each day, but be open more days to try and smooth some of that out. And so, yeah, we do continue to work on all aspects of that and see if we can make it a little smoother and a little bit easier.
Thank you.
Thank you. Let's go to our texting questions.
The first text question is from Shannon Handy with CBS 8. She asks, we've been hearing from seniors who say second dose appointment canceled, but they're having trouble rescheduling. What is your advice for people who can't get their second dose within the suggested window?
Yeah, I hear it from seniors. I hear it from one senior who I live with, my father-in-law, who's 77 with underlying health conditions, has had his second dose canceled 3 different times. And all we can do is just encourage folks, please stay patient. The folks that scheduled that dose or where you went for the first, they will be in contact and they will work with you to get you rescheduled. There's just a critical shortage right now, but we're hoping that increases, and we want everyone to get their second dose, and we hope that it stabilizes so that people don't have the uncertainty and inconvenience of when they're going to be able to get it. But we know it's impacting folks, and it's causing frustration and anxiety, and we're very sorry for that. Again, we hope the supply increases, and we'll be able to get more people more consistently in with less interruptions to the plans.
This next text question is from Mike McKinnon with KUSI. Texas and Mississippi have lifted their mask mandates. President Biden has been vaccinated but still wears a mask. Once San Diegans get vaccinated, do they need to continue wearing masks?
Yeah, we'll have Dr. Wooten address the medical advice around continuing to utilize the public health measures when vaccinated.
The answer to that question is yes, and absolutely. Even if people have been vaccinated, first or second dose, takes 2 weeks for the effectiveness to kick in. But we still need people to continue to wear their masks, wash their hands, and watch their distance, because we do not yet have herd immunity in our community. So just stay the course and continue to practice those preventive measures. Thank you.
Go to our next question.
This last text question is from Saddam Aguayo with Univision San Diego. He's asking for a Spanish response. As a 3-part question. The first part is, how optimistic is the county that we can go back into the red tier next week? What would this mean for businesses around the county? And is there anything in the county restrictions during this red tier different than last time?
Lo importante es reconocer que no estamos seguros qué tan pronto vamos a llegar el nivel rojo, ¿verdad? Por el momento estamos esperando que llegue información del gobernador, y más que nada pues de las personas que son los expertos en cuanto a cuándo vamos a cambiar de fase. Lo importante es recordar que queremos pedirle a las personas que sigan con las mismas indicaciones de seguir usando todo lo que tenemos que hacer para que podamos regresar a una etapa de convivir como lo habíamos hecho antes, pero por el momento no tenemos información de qué tan rápido podamos llegar a otro nivel que sea el rojo.
All right, that concludes our media briefing for today. We will keep you posted on any COVID developments along with any changes to the tiers from the state of California. Thank you.